Good morning, everyone. We've had a large number of cases overnight, 32. 26 of them are linked, the remaining still under investigation. 7 of the 32 cases were in quarantine during their entire infectious period, and at least 24 have spent part of their infectious period in the community. As we indicated yesterday, there are cases at the Calvary Hayden Residential Aged Care Facility, a number of them today, both amongst residents and staff. Work is continuing with the operators and residents at the facility. Dr. Coleman will have some further information on this. We have 10 currently hospitalised, 4 in intensive care and 3 requiring ventilation. There were 2,952 tests yesterday. The Watson pop-up testing site is now available at the Neighbourhood Oval in Watson for any resident in the area who has even the mildest of symptoms. So if you are a Watson resident, please get tested either at this pop-up clinic at the Neighbourhood Oval or via the Exhibition Park clinic this weekend. On the vaccination front, I'm pleased to be able to advise that we have continued our positive discussions with the Commonwealth in relation to the supply of Pfizer for October, and we have been able to resolve most of our concerns. Small number of matters remain to be finalised over the weekend, and we will provide a further update early next week. I thank the Office of the Commonwealth Health Minister, Minister Hunt, and the Prime Minister's Office for their positive engagement on this issue. In relation to vaccination mandates, despite some reporting to the contrary this morning, the ACT has not ruled out mandatory vaccination requirements for high-risk workforces. People would be aware a vaccination mandate is currently in place for aged care. The ACT is participating in national discussions about mandatory vaccination requirements for both the healthcare and disability sectors. It is anticipated that an agreed national recommendation will come to National Cabinet in October. We have already commenced consultation with stakeholders across the ACT public sector as to how to effectively implement mandatory vaccination for particular high-risk workforces across the ACT government. So this is our responsibility as an employer, as distinct from public health mandates that would apply across all settings. In summary, 32 new cases overnight, so that's the equal highest number of daily cases that we have experienced ever in this outbreak. 26 of them are linked, which is the good news. The bad news being only 7 were in quarantine during their entire infectious period and at least 24 infectious in the community. 10 people hospitalised and 4 in intensive care. We are starting to see a large number of patients who are unable to be treated in New South Wales coming in to ACT hospitals. So, as anticipated, the increase in demand on our health system is coming from regional New South Wales, and this is a trend that we anticipate to continue. I'll now invite Dr. Coleman to provide a further update on the new cases and epidemiology, and then Dave Peffer, the Acting CEO of Canberra Health Services, will provide an update on some issues at Canberra Hospital. Thank you.
Good morning, everyone, and thank you, Chief Minister. So the total cases for this outbreak is now 725, with 32 new COVID-19 cases notified since our last update yesterday. We have 492 recovered cases, which brings our active cases at 233. So of our new cases today, of the 32, 26 can be linked to known cases or ongoing clusters. and that we know that 14 of these 26 are actually household contacts. So we're still seeing a high proportion of our cases coming from our household contacts, which is good news. Of the remaining 12, we are still investigating all 12 for further linkages to cases or clusters. And as the Chief has iterated, of the 32, only 7 were in quarantine for their whole infectious period, and 24 we know spent some time in the community for at least part of their infectious period. As to 8 p.m. last night, we have 10 people in our hospitals. 4 of these are in intensive care, with 3 of them requiring ventilation. Of the total 10, 8 are unvaccinated and 2 are fully vaccinated, but these 2 are not those in ICU. So we are still seeing our hospitalisations being people who are unvaccinated. Of our 10 in hospital, age ranges from in their 20s to in their 90s. We now have 971 self-identified close contacts and around 500 active exposure locations. And as we discussed yesterday, we now have a number of cases linked to the Calvary Hayden retirement community. So included in today's numbers are 10 cases. So that's 1 staff member and 9 residents. This brings our total for this cluster to 12. What we know is that of the staff at this Calvary Hayden retirement community, 100% of staff have received their first dose and 53% of staff are fully vaccinated. So in this way, we are very assured that the progress of this outbreak will be very different to what we saw last year when we were all very nervous about aged care facilities. This outbreak still has a way to go, but our initial investigation and preliminary assessment is that we are much better situated this year. And our team does continue to work closely with Calvary, who are communicating directly with our residents, with their residents and their families regarding this outbreak, and we will continue to do so. So today is World Pharmacists Day. So my shout out goes to a very important group of essential workers who I must admit we don't often talk about here, and to all pharmacists across the ACT. So throughout the pandemic, pharmacists have been an incredibly important partner in our response and are now playing an equally essential role to get as many people vaccinated as possible. So to the pharmacists we see every day at our community pharmacies and our hospitals, but also to those working behind the scenes in specialist areas and those who are teaching and developing our next generation of pharmacists, thank you for your dedication, your commitment, and for all you do in the Canberra community. So I'll now hand over to Dave Peffer.
Thank you, Karen. Good morning, everyone. I'm here to advise of an evolving situation that we're currently responding to at the Canberra Hospital. We now have 2 patients who have tested positive in one of our wards in the tower block. These cases were tested positive overnight. We got those results. We did have an initial case who presented to hospital on the 18th and has been in the Canberra Hospital since that time, unknowingly positive, until the test result was returned yesterday. That individual has been in a shared room with another patient who overnight has also tested positive. Our infectious diseases team has responded very rapidly overnight and this morning, establishing an incident management team and conducting a thorough risk assessment of the situation. I can advise that since the positive cases were detected, both cases have been moved to test result back. Any staff member that has worked or consulted on Ward 10A since the 18th, we're contacting to be tested as well. We're working with Public Health to investigate how long these patients have been positive or have been infectious. Patients have been advised to continue to wear masks as they are able and undertake frequent hand hygiene and to remain in their allocated ward area. The ward has been declared a red zone at this time and is currently locked down. Patients who have already been discharged from that ward since the presentation of our unknowingly positive case are in the process of being contacted and advised to test and quarantine. Enhanced infection prevention control measures have been introduced to minimise any further spread. This sort of incident is not new. This has now occurred more than 20 times in our healthcare facilities, and we are prepared for it. We have an expert infection prevention control team who is rapidly deployed to respond to these sorts of situations. I'll now hand back to the Chief Minister for questions. Thank you.
Thank you, Dave. Happy to take questions.
The AMA has said that it's a moral requirement to ensure that all hospital workers are vaccinated, and the Royal Australian College of GPs also supports a vaccine mandate for health workers. Are you going against expert advice by not putting in a vaccine mandate for health workers right now?
No, and I addressed that matter in my opening remarks.
On that matter, that high-risk category that you are speaking about, the National Cabinet to possibly mandate vaccinations, what cohorts are we talking about? What's in that discussion?
Potentially very broad. A question perhaps for the AMA is, do they support mandatory vaccination of GPs? So that work is occurring at a national level. The Commonwealth would have a series of regulatory responsibilities, as they are the oversight body for a large part of the healthcare workforce across Australia. We have a process underway in relation to both our responsibilities as an employer, so health staff who work for the ACT government, and then there's also an overarching responsibility the Chief Health Officer has in relation to setting public health directions, and so that has occurred in the context of aged care, and there is a process underway at a national level that all jurisdictions are providing input into, seeking expert advice in relation to the broader coverage across the healthcare sector. But potentially could be very broad or it could be quite narrow. Those discussions are continuing, and I'm not in a position to preempt what the national outcome of that will be. But what I can advise is that we are expecting that work to come back to National Cabinet in October. National Cabinet is scheduled to meet at least 3 times in October, on the 1st, the 15th and the 29th. I do not know yet which of those 3 meetings this work will come back to. I hope it's on the 1st of October. I don't know whether National Cabinet will reach an agreement in just one meeting. It might take more than one. Once that decision, once the advice has been provided and the decision has been taken, I think it's important that the Prime Minister makes a statement on behalf of National Cabinet and that there is a nationally consistent approach to these matters across Australia.
And what argument would you be putting forward as part of that discussion? Who do you want to see vaccinated?
No, I'm waiting on the health advice. It's not my role to put an argument to National Cabinet. It is my role to take the information and the best advice that is provided by the healthcare profession to National Cabinet. I haven't seen that yet, so I'm not in a position to make arguments at this point.
Chief, health advice, from our local health authorities about anything to do with this?
There's work underway in relation to our responsibilities as an employer, but I'm not preempting a National Cabinet process and a national paper that has input from all jurisdictions from this podium today. I can speak more about the National Cabinet process once it's occurred, but I'm not preempting it.
Chief, is this the first time we've seen cases in aged care residents in the ACT across the whole pandemic?
It may well be across the whole pandemic. Look, I'll need to check on that. There's obviously been hundreds and hundreds of cases going back to last year as well.
Okay, and so we've heard that the staff members at Calvary Hayden did have PPE. But this seems to have got out, and we know it's Delta, but are there any theories at the moment about how the disease was able to be transmitted?
Not that I have heard, but investigations are ongoing The Chief Health Officer may be able to address that, perhaps not today, but as further investigations are undertaken.
What kind of support is available for families at the moment who need information? Because it's a pretty tough situation.
Sure. Yes, there's the full range of supports are available, and again, we can get some further information on that for you.
It's been reported that Australia will be getting its full allocation of Pfizer in October, 9 million doses. Is that your understanding, and do you think this is the end of the supply uncertainty for the ACT?
I hope so. Again, I addressed this in my opening remarks. We're just seeking to clarify some final elements in relation to our own supply. I can't speak for other jurisdictions.
Is the 9 million doses, is that your understanding?
I'm only aware of what's coming to the ACT, with some matters still to be clarified. So again, as I observed in my opening remarks, we're seeking some final clarification on a number of matters, a smaller number of matters over the weekend, and we'll provide some further advice early next week.
At that residential aged care, Dr Coleman said 100% of staff had at least one dose. Do we know about the residents there? How many are fully vaccinated and how many are partially vaccinated?
There'll be a very high level of vaccination. The exact percentages, obviously I'm not in a position to give right now, but we may be able to get that data, but it would be very, very high given both the rollout of the program across aged care and the data across the entire territory for people in those age cohorts. So I think you can expect it to be north of 90%.
Were any of the staff members working at other aged care facilities, and have any aged care facilities been put on alert?
I'm not in a position to address those questions. The Chief Health Officer can. Anything else for me? No. Okay. Thank you.
Thank you.
Aged care, how can I help you?
Yeah, so is this, to your knowledge, is this the first time that we've had aged care residents infected with COVID in the ACT?
Look, I think you may be right. Our previous aged care or retirement village facility outbreak was not a resident. I can't be entirely sure about last year, but my memory is this is the first significant impact we've had.
Yeah, and so what's the theory at the moment of how this was able to spread so quickly to, go from one case, now we've got 12?
So I think we're still investigating how this was introduced to the aged care facility. We're still investigating that. But I do think that we're going to have to become used to the fact that we will start to see more and more transmission as we open up, as we get more comfortable with our vaccination coverage. So I absolutely agree it's really important that we try and work out where source and linkages are at this point in time, but there will come a time in the future where we won't be able to talk about how and where and when this all happened. But at this point in time, those investigations are ongoing.
So just to confirm, there's no source at this stage for that first infection at the facility?
That's correct. So we're not actually even sure what the sequence of timeline of infections were.
Have the infected residents been moved from that facility, or are they still in their rooms there?
So we're currently nursing and caring for all residents still in facility, but we're working closely with a lot of infection prevention and control expertise on the ground, and all of the families of those residents have been involved as well.
How many residents are there?
In total, I must admit I'm not really sure of the whole facility, but we do have, as mentioned, 9 cases in residence at the moment. And someone asked a question previously about vaccination status of residents. It is very high. At this facility, we have 92% of residents are actually fully vaccinated, but 97% has 1 dose. So we have a very high level of protection.
So just to follow up on that, does anyone with the virus at that healthcare facility, are they unvaccinated?
Yes, they are. Yes. So of the 9 residents, we know that the majority of those are fully vaccinated, but 3 of the cases are either only partially vaccinated or unvaccinated. And I think that just goes to show the benefits of vaccination as well.
And of all the residents there, are they being advised how long they'll be expected to stay in their rooms in isolation?
Yeah, so Calvary and the Public Health Unit, as well as CHEC, are working very closely with all families. and we're working through what that means for the individuals. This is a very challenging environment in which to care for people under these circumstances, and we're obviously doing everything we can to make this as smooth as possible but as safe as possible as well.
What about staff there? Is it your understanding that staff have been working at other facilities as well? Have any of those other facilities had to be put on high alert because of this?
So the information we actually have from Calvary is that all staffing working in this retirement village or facility, have elected to be single site workers. So they're only working at this facility and there are no implications for other facilities.
With a lot of household contacts emerging, are we seeing distinct cohorts where people aren't obeying quarantine regulations?
I think as we've talked about, there are many reasons why some people do find it difficult to quarantine or isolate when they're cases or contacts. Some of these reasons are about the accommodation circumstances, so living in a high-rise apartment block or a low-rise apartment block, even with a small balcony or no outdoor area, can make it really challenging. But there are other factors such as the need for financial support and things that can make it more challenging. So there are some cohorts in which we're seeing that, but we won't be specifically talking to those unless they cross over from an exposure site location.
And sorry, just back to the aged care facility, how many people, staff, I would presume, aren't able to work now because they're in quarantine? So is there a resourcing problem now to look after those residents?
So generally over the first 48 hours of a facility outbreak, there's lots of work that goes into really defining what the risk of exposure was, particularly to staff, because we recognise that while having a staff member infectious is probably the highest risk to the facility, we also recognise that there's issues about having unknown staff on site who are backfilling those staff who are furloughed. So it does take us a little while to work through that. I do understand that there's quite a few who are off site in quarantine while we work through that, but we do come up with a process as quickly as we can to work through how we release those staff from a risk-based assessment. We do have a process in place where we can access additional staff members, particularly from our public and private facilities, to provide support for these aged care facilities in this case.
And given that the first case emerged, I think a couple of days ago now, has genomic sequencing been done or been returned? Are we able to kind of link it to cases in the ACT, cases in rural or regional New South Wales? Do we know at least where the virus came from if we don't know how it got into the facility?
So I haven't been briefed on the genomic sequencing that's come back yet, so I'm not sure if it has or not.
If of the residents there that have tested negative, have they made representations or have their families made representations to get them out of that facility because they don't feel safe there at the moment with the cases? And have they been denied?
Look, not to my knowledge. My understanding is that we're working closely with the families of both cases as well as those other residents who may be involved and having very open discussions around what this looks like and what the options are around moving forward. So not that I'm aware of, no.
Would residents that have tested negative, if they wanted to leave the facility because they didn't feel safe there, would they be allowed to leave?
So I think there's some really difficult challenges in that, and I really don't like talking through a whole lot of hypothetical scenarios. Obviously, we try and meet consumer choice, and this is exactly the same circumstance as we can moving forward. And then there's a perception of risk and how we can address that. Often it's a discussion about, well, actually, really, this is the real risk involved, and the best choice may be staying inside, where you're cared for by staff who know what your needs are and how best those can be met. Often, when you're in a retirement village or an aged care facility, it can be very traumatic to actually up and move you somewhere else. So I think there's a lot of complexities around those discussions, but my understanding is that they're all very much happening.
Were any of the new cases today linked to the suburb of Watson?
Not that I'm aware of, no.
Is there a target for the number of tests that you want to do in that suburb, and are there can people go and get tested even if they don't have symptoms there?
So I have an update for you. It sounds like there has been a reasonable response to the clinic today, a bit of a slow and steady response. We've had more than 100 tests done by 11 a.m, but there's certainly capacity still at Watson. So if you come from near Watson and you do have the slightest of symptoms, please come along and get tested at the clinic. Our target is still very much about people who are have the minimal of symptoms. However, if you have concerns or you feel that you might have come into contact with a case such as being a household contact, please come along and get tested.
The Chief touched on regional New South Wales patients having to come here to be treated. When we reopen, does the modelling show how many we might expect from southern New South Wales and what can we cope with?
So I think I might refer that question to Dave Peffer when he's ready to come up. Anything else? Thank you.
Did you hear that question?
No, sorry, could you repeat that?
So the Chief touched on, we're going to have to treat more people that are coming in from southern New South Wales at our healthcare system. How many can we, what does the modelling show? How many can we take? How can our health system cope with this?
Yeah, so we have been planning for this for many, many months, in fact over a year, in terms of the hospital capacity that will be required. The Chief has spoken about the role of the Canberra Hospital being a tertiary referral centre for the region. And of course, we look largely to the east and to the south for those referrals and the retrieval pattern of patients coming in. What we're starting to see, though, is pressure up in Sydney generating referrals perhaps from the west as well. This is all being factored into the planning in terms of what we might need in the weeks and months ahead. It's very hard to put a precise number on New South Wales presentations because that will be guided by decisions that are made outside this jurisdiction, as well as the performance of the health system interstate.
Do you see it, though, being in the hundreds or thousands or...?
I would expect that we will see hundreds of presentations over the next year from New South Wales.
With the cases at the Canberra Hospital, how many staff members are now in quarantine and isolation as a result of that?
So this is an evolving situation that we discovered overnight, and the team is responding as quickly as they can. I know there's some very, very busy phone calls being made at the moment to trace who may have moved through that area. It is one of our surgical wards, but we do have a consultation model where we do have other specialties that will move through that space. So it's not as simple as simply saying what was the nursing team on that ward. We're also looking at all the support workers, so food services and security and so forth. And within the hospital, this was one of our green zones, so we hadn't expected to need to do this sort of tracing here. However, we do certainly plan for this sort of incident occurring. And I do have to say, every day I'm very grateful for the expertise and the commitment of our infection prevention control and infectious disease experts who respond to this very quickly for us.
And with that initial case, is there any evidence that they caught it outside the hospital or within the hospital itself?
Yeah, so there is evidence. In fact, the advice that we've been given is that they did contract the virus outside the hospital. They presented at the time for reasons unrelated to the virus. There was no symptoms, they were asymptomatic, there was no reason, there was no risk or clinical indication that they were carrying the virus. And so that's why they were treated in a green zone.
Are these patients, obviously they're in hospital, so do they have underlying health conditions or are they elderly? Are there any other, high concerns there?
So the initial case, we're still working through the details on both of them. The initial case had come into the Canberra Hospital for a procedure, which they did have.
And sorry if you said this, I can't remember. Are they vaccinated or unvaccinated?
We're still working through those details at this stage.
I mean, is it a concern that this initial patient was there since the 18th and that there's been quite a bit of time for that infectious period to spread to other people?
Yeah, look, it is, but I guess we do see this with asymptomatic individuals where Karen and her team obviously doing a lot of work around contact tracing, working as quickly as they can. And if individuals are unknowingly positive and moving about community, that's where we can see some of these challenges. I think the team has responded as quickly as they could. As soon as we identified that we did have a close contact in the facility, they were swabbed, we had a result within hours, and of course everything has cracked into gear.
And for other people, if they do need to present to the hospital, should they still feel confident to do that this weekend?
Oh, absolutely, absolutely. So this isn't the first exposure that we've had. I think I was here some weeks ago when we had an exposure at the University of Canberra Hospital, and since that time we've dealt with many. I think at the time I reminded people that when you're in a situation of lockdown, if you look across the city, where do we still have very large concentrations of individuals moving into and out of a premise? And clearly the hospital is one of those places. And that's why we're very prepared. That's why we've got full PPE requirements for our team and for individuals moving about our campuses as well, and why we've got a terrific team that is geared up, ready to be deployed as soon as we identify a situation like this.